Thank you very much for the introduction. My name is Hélène Vaillancourt, as was just presented. And actually, Victoria is going to present the real work here. And I just want to provide some background on why CSA was involved in this research. So next slide, please. I suspect most of you, oh, can you click? Sorry, there's another click. There's 2 clicks.
There we go.
Okay, thank you. So those who know CSA Group knows that we are social good at heart. So we doing this through our commercial subsidiaries where we test, inspect, certify products to help make sure they are safe. We also have our standards development organization that also there for social good. Next slide, please. So we've been developing standards for many years, and the standards we develop are really there to help and enhance health, safety, the environment, and trade. But recently, and few years ago, we decided to do even more for social good and develop a research program focusing on standardization. The intent is really to focus on new and emerging areas and to help expedite the development of standards and also identify needs in standards. We look at bigger social issues and we want to see if we want to identify those standards that we think might be needed. Next slide, please. So our research, like our standards, because we have over 3,000 standards and they are in many different areas. Our research is also on many different areas. So we cover occupational health and safety, but we also cover electrical and nuclear, amongst others. And all our reports, we've published so far more than 50 research reports. They're all published on our website, and you can download them for free. Next slide, please. So more specifically, we have a few standards, few research reports, sorry, that we've done that may be in your area of interest. So we've done some work on fatigue. We've done work on violence in the workplace, aging society, and also topics that are more in the healthcare area. So, but one thing that I didn't mention is that we develop our standards using more than 10,000 experts, and we're doing the same for our research. So we hire we work with best experts in Canada to really help us to develop that research. So when the pandemic started and things were shutting down, the businesses were shutting down, we were wondering what we could do to help. So we thought that we could help because we knew one day they would reopen, and we decided to do this project. And we worked with the Atlanta School of Public Health and with Victoria in particular to do this work. So I'm really happy and excited to introduce Victoria. Was going to present the real work that was done. Thank you.
And thank you, Hélène. Thank you to the organizers for inviting us to share the work that we've done in the last 6 months or so. And as Hélène and Sherry described, I'm going to talk a bit about this rapid research report that we completed mostly over the summer, looking at the occupational health and safety considerations for reopening and operating workplaces during the COVID-19 pandemic. And although you're hearing from me and a little bit from Hélène today, this really was a team effort. We at the University of Toronto worked with the CSA group, as has been described, and we received funding from the MyTax Accelerate program, which allowed us to have 6 graduate students work basically full-time over the summer on this project. And we had a very active project advisory panel with representatives both from the University of Toronto, but also from the CSA group. Nikki Islick is on the line with us today as well. I also wanted to acknowledge the contribution of Michel Prévost, who was very critical in the building water systems section of the rapid research report. And certainly, we couldn't have finalized that section without her contribution. So the aim of the rapid research report that we pulled together was to review and summarize occupational health and safety practices that could support safer reopening and ongoing operation of workplaces during the COVID-19 pandemic. We did set some parameters on this. So we limited to prevention practices that could be undertaken in the workplace. So we didn't include regulatory or policy level changes in this review. And we also excluded patient-facing healthcare and the activities of first responders because, well, we felt that they had never stopped working, but also that their exposure circumstances were very different and needed quite tailored and specific considerations that weren't necessarily as relevant to other workplaces. I will also say that this was a broad health and safety review. For folks that may know me from more hygiene or exposure assessment, it was much more than that. It was is broad health and safety issues that were included. And we started with 4 guiding principles that we felt were very important to consider as we worked through the review. The first was that the hierarchy of controls should guide primary prevention as it would or should for other workplace hazards. And as a reminder, this means, starting with elimination as a control, moving to substitution, which isn't an option for COVID-19, and then moving down the hierarchy to engineering and administrative controls, with personal protective equipment being uh, a last resort, or at least one of the controls used, not the only control. We did also start with the idea that any prevention strategy for COVID-19 should not reduce the effectiveness of controls that are in place for other workplace hazards. Other hazards don't cease to exist. They're still there, and we need to ensure that we're protecting workers for those hazards as well as COVID-19. And any prevention strategy for COVID-19 shouldn't, as best as possible, introduce additional workplace or new workplace hazards. We also wanted to emphasize that COVID-19 and the prevention aspect should follow a cycle of continuous improvement, which is part of a good occupational health and safety management system, although that's not in place in every workplace. So we did want to remind folks that this is something that needs to be revisited and improved over time, particularly in the face of sort of the evolving understanding of this virus and of transmission. The approach we took started in May of this year. We began scanning any and all document really that related to the workplace and COVID-19. So we did look to the scientific literature and the gray literature. We also looked to professional associations and technical standards. And we looked even in the media to see where outbreaks were occurring, who was being quoted, what they were saying. And although we were obviously focused on COVID-19, we did look at other infectious disease literature to see what had been done or said about other infectious diseases in the workplace. We then worked to summarize the documents, and we had a particular interest in identifying areas where there was agreement or consistency in what should be done to prevent transmission or introduction into the workplace, and also to highlight areas where there was still controversy or disagreement among experts. And this was important because then we went out, once we had a draft report, we went out to 3 rounds of rapid expert review over the summer. In the first round, we went to very specific subject matter experts. Next round, we focused more on industry experts, trying to get a broad cross section of the industries that are present in the Canadian economy. And finally, we went to occupational and public health leadership across the country as best as possible. And we did want broad feedback from these folks, but we also had very specific questions for them around these areas of disagreement, or areas where it sort of wasn't settled science. We invited over 130 people to participate or to provide feedback, and we actually heard back from over 60 of them, either in written or oral meetings that we had to hear what people thought and what they thought needed to be improved. And so one of the first things that became clear was that, when we're thinking about COVID-19, which is, interesting because although it's a workplace hazard, it's present in the community and people can bring it into the workplace. And so there are 2 opportunities to break the chain in the context of COVID. and the workplace. And the first is by preventing the introduction of COVID-19 into the workplace, so stopping it from even becoming a hazard in the workplace. And the second is to prevent transmission within the workplace. Now, obviously, you can't do these in isolation, but we need to think about prevention strategies at both levels. The results of the review suggested two very high-level first steps. And the first question that every employer or organization needs to ask is, who really needs to be on site for our business to continue operating? And if people are not on site, then you have reduced the COVID-19 from being in the workplace. You have eliminated the hazard. Now, obviously, this is not feasible for many workplaces, but thinking about who needs to be there and when they need to be there is an important first step. And once that's been decided in terms of who's going to work where, a risk assessment needs to be conducted to identify any high or medium risk groups and to identify control strategies to go along with that. And there was agreement from the experts that provided feedback that the risk assessment tool that the World Health Organization put out early in the pandemic was one of the easiest and most straightforward to use. And so that is what we included in the report. And the WHO stratifies or creates their risk groups on using two pieces of information. One, whether the worker has close contact with other people, and then whether that contact with other people, whether those people are known or suspected COVID-19 cases. And so for the most part, the high group shown in this table from the World Health Organization is going to be healthcare workers, with other workers being distributed between the low and the medium groups primarily. In terms of summarizing all of the information that we were able to locate and review, we presented the information in terms of three domains of prevention activities that workplaces can or should consider really in terms of the prevention of COVID-19 in the workplace. And the three domains were the building systems, the organization of the workplace or the workspace, and then the worker level, where you're concerned about supporting physical and psychological health of the worker. And so beyond these three domains, there were two cross-cutting themes that continue to come up as we went through the literature and we spoke to the experts across the country. And the first was the occupational health and safety culture. This is sort of an intangible in many ways, but we do know from the literature that having good or positive health and safety culture improves the adoption of prevention practices and can lead to better health and safety or better performance in health and safety in terms of indicators. And there's no reason to think that this would be different for COVID-19. So this idea that organizations should be working to build good health and safety culture persists. The other cross-cutting theme was communication and the need for open, meaningful, honest communication between employers and workers. Again, this is also a hallmark of an occupational health and safety management system, but a good reminder that, meaningful worker consultation as the prevention of COVID-19 is being implemented is likely to improve adoption of those and compliance with those prevention practices. And I'm going to summarize each of the domain findings over the next few slides. And for these slides, I'm going to talk through the content, but I have provided sort of a very, very short selection of references on each slide. If folks are interested, I mean, the report is also publicly available, and I'll share that link on the final slide. But if you're sort of urgently looking, there's a few notes in the bottom right-hand corner of the slide as I go through. So for domain one, which was the building system, here, although there is a component around reducing transmission of COVID-19 in the workplace, the primary focus of the building system domain was around reducing chemical and microbiological hazards other than COVID-19. And there has been a lot of discussion about this, even in the mainstream media. And there's concern because many buildings were unoccupied for a period of time or operating at a reduced occupancy. Many continue to operate at a reduced occupancy, and the operation of the building systems can affect the health and safety of the occupants. And so What the report suggests is that workplaces consider both the heating, ventilation, and air conditioning systems, as well as the water distribution system. I can hear my toddler pounding away upstairs. I hope you can't hear that too. In terms of the HVAC, the recommendations from the engineering community really focus on things like reducing the recirculation of air. So increasing the introduction of new air or fresh air into the system as best as possible, increasing the air exchange rate so the air is turned over more frequently, and improving filtration, moving to things like MERV 13 filters within the HVAC system. And now these all seem like relatively straightforward recommendations, but remembering that HVAC systems are unique. Not all buildings are the same. They're built at different times with different designs. And so there's a real need to balance the function of the system with the prevention strategies that are recommended, as well as the occupant comfort. And so these changes need to be undertaken under the guidance of an engineer or an expert in the building systems. And this applies also to the management of the cooling towers. This is where the risk of Legionella most commonly arises. It's not the only place, but the recommendation for cooling towers is to operate them continuously. You don't want stagnant water in your cooling tower, providing an opportunity for the growth of microbiological hazards. And similarly for water systems, the recommendations are around remedial flushing prior to reoccupancy if a building has been unoccupied, and if a building continues to be occupied at reduced occupancy, having a plan for preventive flushing at periodic intervals. So that there's no stagnant water in the water system. Again, this can lead to concerns around Legionella, but also the buildup of other chemical hazards within the water system that could affect occupants when they're using the water for drinking or cleaning or washing and things like that. But again, with the water systems, the idea of flushing seems very straightforward, but there are health and safety hazards that can arise from that process for the workers that do the flushing. And so this needs to be also done under the supervision of experts, either engineers or building system experts here as well. For domain 2, this focused on the workplace organization and the physical design of the workspace where the workers are doing their work. And the primary goal here was around reducing the transmission of COVID-19 in the workplace. And the recommendations focus largely on the adherence to physical distancing and the other public health recommendations that may be in place. In terms of physical distancing, we've talked a lot about this as a society over the last several months, but we're talking about reducing the number of people in a space at the same time, reducing the number of close contacts that people have, and reducing the duration of those close contacts. This can be done in many ways, and I'm sure many people are already being very creative about this. You can change the layout of the workplace. You can change where work areas are located. It could mean changing the shift schedule so that fewer people are on site at the same time, and so that you could stagger shifts so that people are not all arriving at the same time and leaving at the same time. So trying to reduce the number of times people congregate over the course of their work. It can mean things like changing traffic flow. I'm sure many of us have been into the grocery store and trying to follow those arrows up and down the aisles. One of the key things that came out in our review, but also in our consultations, is the reminder that physical distancing in particular really needs to be done both in the public facing areas and in the worker only areas. And there was, I think, a lot of confusion in Ontario around what was required in the public areas versus the private areas of workplaces. But from an evidence and a scientific perspective, all of these preventive measures that we're taking to reduce transmission of COVID-19, the best practice is to follow them everywhere, not in some areas and not in others. The virus does not care where we're standing or who we're standing next to. The transmission can still occur. And so reminding and ensuring that workers are following the physical distancing and other public health measures, even on lunch break and on coffee breaks and things like that, is important. Other public health measures that obviously are also important in terms of reducing transmission are increased disinfection and sanitation, in the workplace of those frequently touched surfaces, supporting good hand hygiene practices, using personal protective equipment where it's recommended, and that also the use of masks and face coverings, which has, since we wrote this report, become more and more common, and in fact, a strong recommendation largely across the country now. The third domain focuses on the worker level, so the worker themselves and ensuring their physical and psychological health. Here, the goal in this domain is both about reducing the transmission of COVID-19 into the workplace, so trying to prevent it from ever showing up in the workplace, and then also reducing transmission within the workplace. And the first big topic that came up when we were looking at the literature here was around the monitoring of cases, including things like health screening, so temperature measurement, symptom screening questionnaires. And, the evidence is not good for the efficacy of these tools in terms of identifying cases, but they are, I think, there isn't evidence, but the suggestion that came out of our work and from talking to people was that they do serve as a very good reminder for everyone about what the public health guidelines are and what the requirements are. And also they're a very clear statement that there are policies and procedures in place. They're very visible, and this can help people feel comfortable coming to work, and can help people feel comfortable coming on site if they're not employers. There also was a lot of evidence supporting the need for ongoing education and training around COVID-19 and the prevention measures that are needed. And the message being that the more workers understand why they're being asked to do something, the more likely they are to adopt these practices and to follow them quite closely. A big issue that was highlighted in our consultations, but also in a lot of the materials we reviewed, was the need for providing the necessary accommodations for workers with disabilities during this pandemic, and the reality that COVID-19 is affecting workers very, very differently. Everyone's experience has been different of COVID-19, and COVID-19 may have radically changed the accommodation needs of workers. So some workers that may not have previously needed accommodations may now have new accommodation needs. Others may have altered needs, and some may have indeed actually fewer accommodation needs. And one of the examples that was given to us was around the use of masks, and there has been some coverage of this more broadly, but masks cover the face. And so people who rely on lip reading for communication are going to face big challenges in communication. There may be people that were able to hear and communicate quite well pre-COVID-19, but the wearing of masks also reduces the sound level. It reduces the ability of people to hear voices in the workplace. And so people that didn't need accommodations previously may now have new accommodation needs. And it also may arise from new work environments. So many people are being asked to work from home. This has sort of been broadly adopted even by organizations that were not particularly work from home friendly prior to COVID-19. And for some people, they may have accommodation needs at home in terms of the workspace and the setup and the equipment that they need. Other people may have reduced needs because they're in their own home and they can care for themselves much more easily than they could in the workplace. But there is a need to address and to check in about the challenges of these new work environments. There is evidence that when people work from home by choice, there can be positive impacts on their health and well-being. But when people are required to work from home and there is no choice, this can have detrimental effects on their health and well-being. And so that sort of leads nicely into the need to support workers' psychological health. There is a lot of stress for people right now. This stress can arise from personal circumstances, members of their family that may have lost work or lost income, as well as workplace stressors that perhaps weren't there. So people are being asked to come to work in the pandemic to serve the public, to do their job during a very sort of unprecedented time. And that in itself is can introduce a lot of psychological stress for those workers that are being asked to do that. And so there is a need to make sure that workers are aware of what supports may be available either through the workplace or through organizations like the Canadian Mental Health Association or through the public healthcare system. And the last component of this worker domain was around the financial supports that are available. And this is, not something that we normally think of in occupational health and safety. But during this pandemic, we are asking people to stay home from work when they're sick or when they've had contact with someone who is sick. And asking people to stay home can have a large financial impact on themselves and their family. And we need to acknowledge that, and we need to support workers in terms of making them aware of what financial supports may be available, either through the workplace, through the provincial government, through the federal government, and how they can access those supports. And this really is sort of one of the key parts of reducing the introduction of COVID-19 into the workplace. If people can safely stay home, that's going to be the best way to eliminate COVID-19 from the workplace. Now, that is an aspirational goal, but I think it's something we need to be aware of. So the key messages from our rapid research report, COVID-19 is a big challenge for workplaces. And although it's not in the text here, COVID-19 is an occupational disease. Workers are getting COVID-19 at work, and that is going to impact their quality of life and their health. Importantly, and perhaps unlike many other workplace hazards, COVID-19 can affect people outside of the workplace. So if someone acquires COVID-19 at work, they can then take that home to their families, their friends, their community. And so by us doing our part in occupational health, we can have a big impact on public health more broadly during this pandemic. And in workplaces, we do want to, as a reminder, focus on preventing COVID-19 from coming into the workplace and also preventing transmission within the workplace. We can't focus on one or the other. We need to be thinking about both of these at the same time. And, really it is suggested from our report that employers and organizations need to be thinking about prevention at many levels. So they need to be thinking about the structure, the building, and how it is supporting health and safety, the workspace, as well as the worker. And from previous evidence, we do know that multifaceted controls, or the layering of controls, is likely to be more effective in preventing occupational diseases. And, I think we do think that that's going to be similar in COVID-19. So really thinking about implementing controls from across the hierarchy and thinking about implementing controls at these different levels that we outline in terms of these three domains is going to be the best way forward in terms of working towards preventing COVID-19 transmission. And we do, I think we're very happy with the work we've done, and we're happy to share this report with everyone. We think that the report does provide some support and guidance for employers on the front lines. It is, fairly high level, with the acknowledgement, that individual industries and workplaces will need to sort of tailor these to their particular situations. But here is the link. I've shown it here. It's quite long. I found that if you type CSA group research reports COVID, it is usually one of the first, if not the first, result in your search engine of choice. And so I will stop there. I will say one last thank you to the folks that were, very intimately involved in getting this report pulled together here, both at the University of Toronto and the CSA group. It certainly was a lot of work, and it was a real big team effort. And I've put my email up here if folks do want to reach out directly, but I'm very happy to take questions now. And Helen, I believe, is going to stay on the line if there are questions related to the CSA programs more broadly. So thank you very much.
And thank you both, Victoria and Helen, for discussing the CSA research report, which blends recommendations and stats with a best practice guide to better resource organizations to reopen and protect their workforce during COVID-19. Throughout the session, we were monitoring the chat. There wasn't any questions that were shared. You did answer a couple of questions during the presentation, and mine were that I feel some members of the group may have are in regards to audience. And so right at the very end, I'm wondering if you can provide some insight. Your primary audience, was your primary audience the employers? And do you have any suggestions and recommendations for different workplace stakeholders that may be able to bring the results of your report back to their workplace for action? Whether it's the different domain sections you might recommend that they focus on, different target audience and internal responsibility, those who are involved in the internal responsibility system at their workplaces, to share the results and obtain further action moving forward.
Yeah, thanks for that question, Sherry. I think our audience was broad, and I do think that the report is helpful, not just for employers, but for members of joint health and safety committees and also unions and worker groups that may be interested. And one thing that was nice, that CSA really pushed us as a research team to also develop a guidance document. And I didn't describe that structure in any detail in the slides, which I apologize for, but there is, the report has a sort of long narrative review that it isn't technical in nature, really. Anybody that's interested, I think, could pick it up and have a read. But the second part, part B, is more of a condensed guidance document that's written somewhat in the language of the CSA standards, although it's not a standard. I'll be very clear on that. But it does take a summary of everything that's in the report and sort of put it in a more actionable list of things that people could take back to their workplace. And I think that those are reasonably things that anybody could take back. I think that in the domain 1, when we're talking about the building systems, that's certainly a difficult topic for a worker to affect positive change in that arena. But there's no reason that questions and suggestions couldn't be taken back to the workplace by anyone in terms of thinking about those considerations.